talking about the World Ambulance and Paramedic Day that is being celebrated every July 8th. And we have in the studio with us this morning the Commissioner for Health in Ogun State in person of Dr. Tomi. Good morning, Ma.
Good morning. Thank you for having me.
Yes. Glad to have you join us this morning.
Okay, so you want to go first?
Okay, yes. So we're talking about the International World Medics and Ambulance Day. Like, how would you say this celebration is important to discuss?
The Ambulance and Paramedic Day is important because between the community and the hospital, it's the ambulance that actually, the pre-hospital care is the ambulance services, and we tend to ignore them. We talk about facilities, but we don't remember the people that rescue us when we are in desperate, when we're in crisis by the roadside, or when we have medical emergencies. So it is vital that we celebrate our silent heroes.
Okay, so also, can you also walk us through what emergency medical ambulances service currently look like in Ogun State?
So in 2019, when we came to Ogun State, we had about 6 ambulances, and they worked between 7:30 and 3:30 civil service hours.
Wow.
But we're very grateful to His Excellency Prince Dapo Abiodun, because since 2020, the fleet of ambulance has increased to 30, and the service is 24/7, and our presence is in all 20 local government and 26 constituencies. So it has really ramped up, and the narrative has completely changed. We now have a call center where you can call 24/7, and this is the number.
Okay.
And we'll be sharing that later. So if you have medical emergencies in your homes, you could actually call us. We also have 80 tricycle ambulances. So we have 30 advanced and basic life support ambulances, the big buses that we see, and 80 tricycle ambulances for the rural areas, particularly maternal and child care. And also 2 boat ambulances for our riverines area, Ipokia and Ogun Waterside, where we've been, and you'll see hamlets along the waterways. So we're able to reach those. So there's no part of Ogun State that our ambulance service cannot reach now. And that is thanks to the focused investment that His Excellency has done into the health services in Ogun State.
I mean, it's quite commendable what the administration of the governor, Mr. Abiodun, has done. Now, in medical terms, we say that the first hour after an accident has occurred is the golden hour. So now, talking about rural communities, how long does it take for an ambulance to get there? Because this process, this time differences are very crucial. Especially, talking about, aside talking about crashing, we're talking about mother care, antenatal care. How would you say, or how would you rate the time that the ambulance would use to get to these communities and these areas?
On average, across Ogun State, our response time is less than 30 minutes. We're trying to reduce it. When we came in, it was over an hour. Well, it's less than 30 minutes. But to address the rural ambulance system, what we've done is we've actually trained the people we call first responders within the community. So it could be a pastor, it could be some person of significance. We let the community choose who they prefer to be the first responders, and we've trained 2 of them in each community, and they're the ones that drive the tricycle ambulances, and the government actually give them stipends to do so. So the woman can easily knock on their neighbor's door if they don't have a phone, and that is the critical part of it, because it's a community ownership. So our response time, it varies. It depends on the individual. From call to getting to the facility, definitely less than half an hour.
Beautiful. Okay.
Okay. Okay, so I also want you to talk about the current state of emergency and ambulance services under OGCS.
Okay, so OGCS is the Ogun State Emergency Services, and as I said, we have 30 ambulances. In this year alone, between January and June, we've actually picked up over 500 people from the roadside. Unfortunately, we've had some fatalities, about 41 fatalities, and but we keep responding. That's what we do. And with the maternal health, we've had 250 people that we've actually taken to the primary health center, another 81 to the secondary facility from the rural area. And we have a sort of about maybe 80 or more mothers that we have delivered, so that we've taken to delivery. But when you talk about antenatal care, we don't, in the rural area, we don't only do emergency services. We actually use the transportation to get them to antenatal clinic, because we know that people have challenges in the rural area paying for transport, and then they don't access antenatal care. So we've taken over 1,000 women to attend antenatal care, just to increase facility deliveries. And what we found is that they don't only just use it for maternal cases. Now we're seeing neonatal, they pick up children, and even adult trauma in the rural area. So that is what is happening. But the challenge is awareness.
Okay.
The people are not aware. They're not calling the ambulance. We need to start calling the ambulance. When an accident happens, typically people call me rather than call the number.
Okay.
And you know, by the time you've wasted 2-3 minutes, maybe I'm in a meeting or whatever, of calling me, don't call the commissioner. Call the ambulance number, which is 0811 2000033. 0811 2000033. That is the number to call. Don't call the commissioner, don't call the director, don't call your neighbor, call the ambulance.
Maybe we should blame this on sensitization. A lot of
absolutely.
So what is the government doing with regards to sensitizing the residents of Ogun State as to the numbers to dial?
So we've done a lot of work over the last 12 months, because we realized that it seems that our people, number one, do not trust the system. And number two, they seem not to be aware of the numbers. So we've come on shows like this. We've scrolled our numbers on your station. We've gone on radio stations to talk about our ambulance service, and stickers. We have stickers on, we've gone to motor parks to distribute stickers, and we keep trying every avenue. But I think
talk about trust.
Yes.
Why do you think they don't trust the service?
No, I think it's just historical.
That's the misconception.
Yeah, it's historical. It's historical that they don't actually believe that when people say things are available, that they are available. And also social media, people who call themselves, you know, influencers, that give misinformation about the state of things. And it is crucial when we have access to people to always make sure that we communicate the right information, because when people are in crisis, is what they heard that they would,
Yes.
So we have to make sure that it hurts me for people to actually lose their lives when the service is there. And sometimes it's only 5 minutes away. And we put out the wrong narrative.
So speaking on celebrating the silent heroes, now we're talking about the International Paramedics and Ambulance Day. There's some challenges that our medical personnel, the responders, are going through. So can you tell us some challenges that might not make the work easier?
So being a paramedic is a lonely job, because most times they are located on the wayside. We try and provide stations for them where they're shaded from the elements, but it's just the driver and the paramedic, so that they can respond on time. Most of us work in an office where you have a friend to talk to. So, and also in the Nigerian, in the civil service structure, there's no cadre at the moment in Ogun State called, even in the federal structure, called paramedics. The first state to address that is Lagos State, and Ogun State is in the process of actually creating that cadre so that they can have career progression if they choose to be paramedics, because it's a well-recognized international cadre. And they have very specialized skills. They're not just nurses. They can respond and treat people pre-hospital, and that is the crucial hour that saves lives.
Yes. Okay. As the Commissioner of Health in Ogun State, can you tell us some of the achievements that has happened over the past year, especially in terms of emergency response?
So those are the things that I've just been telling you about. So we've acquired 10 more ambulances. Well, we set up our call center. If you pick up your phone now and call this number, there'll be someone at the end of it. And I want you to do it on this show.
Okay.
I want you to do it on this show. And so those are very important things to make sure that when people call 24/7, there's someone at the end of the phone to pick you up. We're formalizing, it used to be a department, but it's been structured better so that we can move into an agency, because it needs to be well structured to respond to its own needs. So those are the achievements that we've made. I must say that some of our innovations have been adopted nationally. For instance, our rural ambulance system has been adopted nationally. That's what Nigeria is using, and it was first tested out in Odeda local government. So we're very proud of that.
It's okay. Okay, so this year's theme talks about innovate and integrate. Is Ogun State looking towards bringing, tech into the system? Talk about telemedicine, talk about GPS, to speed up things.
Oh, certainly. You could even nickname me Miss Innovation, because that's my strategy.
That's your strategy.
And innovation is not just tech. Innovation is even changing the way you do something, and that's what we've done throughout Ministry, the health sector. So we actually have telemedicine in our rural. We absolutely have telemedicine. We have electronic medical records. You see, you're going wow. We have telemedicine. We have electronic records. We track our ambulances.
Even in the rural community.
Absolutely, there's tracking. And there's also GPS, because that's the only way, this is even a Nigerian thing, that's the only way that they can verify that our ambulances have actually picked up the patients, because some of it we get refunded by the federal when we use the basic and advanced life support ambulances. So there is tracking. We also have CUG, closed user group telephones. So when if you're leaving Emulu village, which is Aderu village where I come from, and you're taking someone to Ijayi, you could actually call ahead so that they know that this sort of patient with this medical condition is on the way. They can tell you that there are no beds. Can you take them to another hospital? So we're using all that. We're relying very much on technology.
Okay. Let me take you a bit away from tech and all of this. Let's talk about training. Is it okay? Some people have argued that in that line of paramedics in Nigeria, especially, they are understaffed. Does this affect Ogun State also? Do we have are they understaffed when it comes to the paramedics in Ogun State, and are there trainings for them?
So I think what is universal, be it England, be it America, be it Nigeria, be it Ogun State, is shortage of human resource for health. There's always a shortage. We've tried our best to make sure that we have enough staff, and we have the permanent staff and we have our locum staff to fill the gap. We try to make sure that work-life balance, we observe the work-life balance in our paramedics. They don't do longer than a 12-hour shift, so that they can rest as well, because when you're tired, your judgment is challenged. is not as sharp. What was the second part of the question? I know you asked me to.
I was talking about training.
Training, we do train them. They have regular training. We make sure we train them. But the first thing is for them to get the qualification to be a paramedic.
Okay.
For us to train them is to sharpen their skills and to hone it.
Okay.
But they need to train as paramedics, but we do use nurses as well, and our nurses, we train them to operate as paramedics. If not drivers, we mustn't forget them, because they're the pilot of the vehicle, and I want to acknowledge them, because we're talking only about paramedics. The paramedics cannot get to the place without the driver, and most times the driver assists the paramedics in responding, so they are trained as first responders as well. So we celebrate them as well today.
Okay, you are part of our silent heroes.
Yeah.
Ogun State is made up of 20 local governments,
yes,
with different needs and challenges. So how would we balance ensuring that there's adequate response time in the rural communities and those in the urban communities, especially we have higher emergency demands? Perhaps a season where we have higher emergency demands. Now, how do we strike a balance like that?
No, it's about planning and distribution. We're very clear what the population. I know the population in Ota is over 1 million. I know the population in Odeda is 200, 300,000. So there are some local governments that would have 3 ambulances, and there are some that would have 1. And some might have more tricycles because they're more rural. And that is how we balance it. There's a lot of thinking. The emergency team, they have weekly operational meetings that last about 3 hours, reflecting on what they responded to that week and what they need to respond to. So it's a very specialized area, and we're continuously reviewing, and they report to me on a monthly basis how many people they picked up, and our near misses, our gaps, and where we need to mobilize resources.
Okay, let's talk about partnership. Is the state partnering with private, because I know that some other private organization actually run ambulance service, or is it a matter of every malam to his kettle?
No, not at all. About 2-3 years ago, we did a mapping of all ambulances that we feel are fit for purpose in Ogun State, both government and private, because we wanted to pull in our private sector into the response, because there might be a private ambulance that's nearest to where the incident is. But what we haven't been able to do is move that discussion forward because of remuneration. We have to make sure that we have enough funding to actually pay for the services, because the private sector is there not for charity but to be paid. But I know hopefully before the end of the year, we should be able to be in the position, because there is a national drive to that. It's important to note that government can't do it all. And public-private partnerships work. They bring efficiency and they bring wider coverage. And that's a strategy that we're applying in the health sector, to make sure that any resource that is in the hands of the private sector that can be of use to the general public, that the government is positioned to utilize those resources and remunerate them in a reasonable way.
Okay. Okay, so as we celebrate our silent heroes today, is there any activities from the government to celebrate them today? Is there plans from Ogun State to commemorate today?
Yes, leaving here, we're going to go on a walk, an awareness walk to celebrate that, and the director will be doing them good. I'm sure he's going to have some parts for them also. Okay. I hope. I won't be funding that. He will. No, they will be celebrated today. That's just a joke.
Okay. Yes. Okay. Yeah. So we have the walk after
immediately after this at 9 a.m.
Yes, so we'll walk and sensitizing
the public,
people exactly can get to understand and, you know, change that misconception that if I dial this number, nobody's at the other end to pick. And yes, we were actually going to, you know, give that a trial. So
yeah, please go ahead. I really want to prove this.
Let's do that quick experiment.
Yeah.
Yes.
0811.
0811.
Okay. You should cram it. Yeah, without looking at it, you should. It's easy.
0811 200 0033.
Oh, bravo. Okay, so let's dial.
0811.
Hold a second.
We made it easy so that people can actually remember it.
Of course.
And we hope with time that we'll have a universal number, an emergency number for the entire Nigeria.
Okay.
Then also, there's a question I would like to ask. I mean,
please carry on there. Yeah.
0811 200 0033.
Okay.
Is there a way we can make this number shorter? Perhaps to have something like a 131, you know, just 3 numbers. That's easier for people to remember, because when you're at the point of an emergency, you're not thinking of a lot of things. A lot of things are passing through your mind, different emotions. You're trying to save a person. So is it possible to have, you know, something very...
Nigeria has an emergency number 112.
Okay.
It's the National Communication Commission that has that number. And Lagos is connected to it, but they're rolling it out gradually over other states. We have approached them this year several times to support us in activating that. Why that is important is if you drive from the beginning of the Lagos-Ibadan Express Road, you go through 3 states.
Yes.
Yeah.
And you do not know at what point you've crossed from Lagos State to Ogun State to Oyo State. So, per adventure someone has an accident on that road, they should be able to call one number.
A universal number, yeah.
And
that
get,
works.
yeah.
So, we're dialing the number. Of course, we're dialing the number. And
yeah, we can keep talking. Well,
of course.
I'm so confident.
Any personal story?
Oh, somebody picked.
Okay.
Hello. Hello, good morning.
So there's an accident.
Oh, live on emergency service. Anyway, you're live on Ogun State Television, where I have the Commissioner for Health in person of Dr. Tomi. And we're trying to call the ambulance service here in Abeokuta to be sure and to also sensitize our viewers that there's somebody back there that is going to pick up the call. And yes, this is very impressive. Thank you. And by the way, happy World and Paramedics Day celebration, and Ambulance Day celebration. I mean, I hear it's your day today, so we're celebrating you.
Yes, ma'am. You're celebrating today.
Yes, we're celebrating our silent heroes. Thank you for your service.
Thank you very much, ma'am.
Yes, it's very impressive. Thank you.
Thank you. Have a nice day, ma'am.
Okay.
Oh, I'm proud of my team. Please celebrate them.
You should give this to them.
I do it. 2 a.m. I wake up and I call them. I test my system all the time.
This is really very beautiful.
Just so you know that it's really working. So before the call, I was about to ask you if there was any personal story that really touched you during the process of, you know, emergency services, ambulance. Has there been any personal story so far that really, really, you know, touched you?
You know, I do wear many hats, and I'm trying to see the one that stands. Oh yes.
So regarding emergency.
Yep. I was on my way to University of Ibadan about 2-3 years ago. That's my alma mater, and my So, and we were driving along, and we saw a passenger vehicle. They had been in an accident, shoes thrown out, people on the side, and it was my driver that stopped, and we called the ambulance service. And they showed up, and we were able to assist them to go. It was just past Ogere, so we were able to assist them to go to Olabisi Onabanjo, and you know, that it warms my heart that I can be confident enough to stop and know that my people will respond, because if I know they're not going to respond, I'll probably pretend I didn't see. And another time, this was quite an upsetting one, in that I was driving along and there was a gentleman fitting on the road, and he was just by the roadside. People were running away from him, his relatives, or he had come to buy something. And so we called the ambulance and they came and supported him.
Okay. So on the final note, is there any word for residents of Ogun State concerning, ambulances and paramedics?
Yeah, I want to let the people of Ogun State know that you have an active ambulance service that is ready and willing to serve you. And before the hospital, there is an ambulance service. So please use it. And the number is 0811 200 0033. And I'm wishing all the paramedics and the pilots of our ambulances a happy International Ambulance and Paramedics Day. Thank you.
Thank you so much for being on the program, and thank you for shedding so much light, and what we don't know. Thank you for, also shedding lights on paramedics and what it takes to get to that point.
Yes.
We'll now take a short break, and when we return, it will be time for trending.